Hey there, my name is Dr. Casey Greene, PharmD and Certified Functional Medicine Practitioner and Clinical Liaison for Revelation Pharma. Today I'm going to be covering zinc and its various clinical applications. So we'll cover what is zinc, how does it work, what are clinical support uses and benefits, what are administration options from oral to IV, and are other options available or should they be avoided, testing and monitoring, side effects and precautions, looking at various safety parameters, and popular clinic protocols that are good to use. So what is zinc? It's actually a lot of different things. It literally does hundreds of processes in the body across many, many different systems and is very, very abundant in the body. But it's a trace element, it's a mineral, it's also an electrolyte as well as a cofactor in many, many, many reactions, and has a huge impact on overall health, as you'll see here soon if you're not aware. So how does it work? So enzymatic activity is one of the major ways that it works in many of the systems of the body, but it is also highly involved in gene expression and protein synthesis. So down to the DNA level, zinc is critical. Even in the development of a fetus, it's just critical in all of those parts, as well as many different organ systems. Immune function is one of the biggest areas, and what probably most practitioners use it for in outpatient settings. And then antioxidant defense, which could even be linked back into immune function, but in some ways classified separately. So it's been very well proven in wound healing. It has a lot to do with the integrity of the skin and healing and tissues through its effects on DNA and cell replication. It affects taste and smell perception. So for example, high doses of zinc for too long could alter taste and cause a metallic taste in the mouth. Growth and development, as I kind of mentioned before, even starting as a fetus, and reproductive health, everything from boosting testosterone and fertility in men to improving reproductive health in women as well. So what form to use? So orally, these are some of the most commonly seen forms: your gluconate, citrate, aspartate, picolinate, and acetate. Different forms could be used various ways, but then on the injectable side, we more often see sulfate or chloride. So when it comes to oral, only the chelated versions of zinc, such as aspartate or picolinate, really have better absorption, but can still cause GI upset in some people. So the oral forms are all going to cause a lot more GI upset on average. And notably, zinc in various forms is one of the very few things to actually have studies showing that it reduces both the incidence of catching colds and the length of the common cold by anywhere from 12 to 48%. The injectable forms aren't as affected on the other side with GI symptoms or the limited bioavailability of the oral forms. So there, the sulfate or chloride salts are the most commonly used. But just be aware that since injectable IV zinc is nearly 100% bioavailable, it needs far lower doses than many or most of the reported oral doses you might see online in order to avoid toxicity. And then with the injectable forms, you want to note too that different salts will have different amounts of elemental zinc. So that means basically that the same amount of zinc sulfate to zinc chloride will not yield the same amount of elemental zinc. So zinc chloride would actually put more elemental zinc into the body and be a potential risk for toxicity sooner. That's not to say one form is better or worse than the other. That's just to say that you need to know the difference in dosing different strengths of each one and that they're not exactly the same. So now some clinical support uses and benefits. So this is just really broad, and we'll get really deep into this in a moment, but immune support, like I said, is one of the major areas that you'll see zinc utilized in. But it's also great for reproductive and fertility support, antioxidant support, and even hormonal balance support, which many practitioners are unaware of. And now getting deeper into the immune support. So the broad categories here, and I'll go deeper into each one, but immune cell development and signaling. So zinc is necessary for the development and functioning of many immune cells, including from neutrophils, natural killer cells, macrophages, lymphocytes like T cells and B cells. These cells are essential for, of course, defending the body against pathogens, and zinc supports the maturation and differentiation of these immune cells, enabling them to carry out their specific functions in recognizing and eliminating pathogens. And then as far as immune cell signaling and communication, zinc is highly involved there. It helps coordinate immune responses, facilitates transmission of signals between immune cells so that they can speak back and forth to one another and mount an effective defense against pathogens. It also modulates the production and secretion of cytokines, which are molecules involved in regulating immune responses and inflammatory responses that we need in the right amounts to fight infection. So it helps maintain a balanced immune response by influencing the production of these different types of cytokines. And then as an antioxidant and anti-inflammatory properties, it protects immune cells from damage caused by free radicals. Of course, free radicals could lead to oxidative stress and inflammation and impair the immune system. So zinc's antioxidant activity helps neutralize this, preventing oxidative stress and thereby supporting immune health. And then it also exerts its own anti-inflammatory effects, can modulate the production of various inflammatory mediators, making the immune system and the inflammation around it better balanced. Then as far as skin and membrane integrity, as I mentioned just a bit earlier, it can be great support in wound healing. So zinc plays a big role in maintaining the integrity and function of the skin and the mucous membranes, which act, of course, as physical barriers against pathogens. And it supports the building of these pathways, such as with collagen and things of that nature. And then last but not least, it's highly involved in antibody production. So as you can see, zinc has a huge array of uses and is absolutely critical for immune health. And then with reproductive and fertility support, this is an area that many practitioners don't realize that zinc is so good for. So with men, not only fertility and sperm production, but precursor to that, testosterone production, which can help men to feel better, have more energy, all those things associated with having adequate amounts of testosterone. So with sperm production, zinc is essential for the development and the maturation of sperm cells. And it's also involved in the actual production of testosterone, of course, the primary male sex hormone, which further enhances fertility and sperm production. So it's also involved in sperm quality, including sperm count, motility, morphology, protects them from oxidative stress, and protects the DNA structures, and helps impair, against infertility. And then prostate function, zinc is concentrated in the prostate gland, where it plays a huge role in prostate health and function. So adequate levels of zinc are critical in the normal growth and differentiation of prostate cells and maintaining normal and healthy function there. Then with women, zinc is involved in hormone regulation and everything from egg development, fertilization, and implantation to fetal development. So zinc is involved in the synthesis and the metabolism of these various reproductive hormones, from including estrogen and progesterone. It helps regulate the menstrual cycle and ensures proper hormone balance. Then on the egg development and fertilization side, it's necessary for the maturation of the eggs and their release from ovulation. So adequate zinc levels support that healthy egg development and increase the chances of successful fertilization. Then it's also involved in implantation and the early pregnancy process all the way through, from early embryonic development, supporting the growth and development of the fertilized egg, the zygote, as it implants in the uterine lining and progresses through early stages of pregnancy. And then in fetal development, there's been known adverse outcomes and birth abnormalities and things like that in cases of inadequate zinc levels. So having adequate zinc levels highly associated with better odds of full health all throughout the entire pregnancy process, as well as just in general adult health with their reproductive systems and fertility and balance of hormones and in general feeling better. So antioxidant support, and this one ties back in and of course is a further support mechanism for immune health, but is in a way its own side as well. So free radical scavenging, enzymatic antioxidant defense, anti-inflammatory effects. So it acts as a scavenger of free radicals, cleaning up the oxidative damage, and it helps neutralize free radicals, donating electrons or stabilizing them to prevent oxidative damage. So yet another way that zinc is involved in healthy DNA and splitting and maintenance of cells all throughout the body. Then it's got enzymatic antioxidant defense. So it's a component of several antioxidant enzymes, including superoxide dismutase, which converts the superoxide free radical into less harmful hydrogen peroxide, protecting cells from oxidative stress. And then zinc is involved in the synthesis and activity of other antioxidant enzymes like catalase and glutathione peroxidase, which all of us have heard of glutathione's amazing antioxidant capabilities. But zinc is a critical part of that cycle as well, supporting glutathione, which further contributes to antioxidant defense. And then zinc is crucial in the synthesis and activation of metallothioneins, a group of small proteins that bind and regulate various metals. So through this, it has antioxidant properties as well and helps against oxidative damage of sequestered metals built up in the body. And then just in general, strong anti-inflammatory and modulatory effects. So zinc just very critical in overall health here and maintenance of the body. And then with a hormonal balance support, so again, I mentioned this earlier, but an area that most practitioners aren't really aware that zinc can provide so much support here. So with hormone synthesis and release, zinc is involved in the making and secretion of various hormones throughout the body that are needed for proper functioning of enzymes involved in hormone production. For example, zinc is necessary for the conversion of cholesterol into steroid hormones, which includes progesterone, estrogen, and testosterone. And adequate zinc levels are essential for normal production, release, and regulation of these hormones, ensuring balance and optimal functioning throughout the body. But not only the hormones themselves, but it actually helps in regulation of hormone receptors. So zinc is involved in regulating the activity of hormone receptors. They're located on the target cells and bind to specific hormones, triggering cellular response. And zinc helps maintain the sensitivity and responsiveness of these hormone receptors, ensuring that they properly interact with hormones. So it really is involved with all ends of the hormone cycles, trying to maintain and keep balance. And then notably with thyroid hormone regulation, zinc is huge. So it's really important in the synthesis and metabolism of thyroid hormones, from the conversion of inactive thyroid hormone T4 into the active form T3. Proper zinc levels are necessary for maintaining thyroid hormone levels, which play a critical role, in, of course, metabolism, growth, development, and energy production. And then finally, insulin regulation. So zinc is involved in regulation there, of course, produced by the pancreas and plays a central role in blood sugar regulation. And zinc is required for insulin storage and secretion. So and it also enhances the binding of insulin to its receptors, so therefore improving insulin sensitivity, which is, of course, absolutely critical and so associated with even cardiovascular health and all that as we know now. So, and by that it promotes efficient glucose uptake into the cells where it can actually be used for growth and energy versus causing harm building up in the bloodstream. So this supports the overall glucose metabolism and helps maintain balanced blood sugar levels and health around insulin sensitivity. So, to sum it up, zinc levels are essential for supporting hormonal balance and optimal hormone function, and can lead to zinc deficiency, leads to hormonal imbalances affecting many different aspects of reproductive health, growth, development, metabolism, and overall well-being. So administration options. So the recommended daily allowance is between 8 to 13 milligrams per day for adults, depending on gender and age and factors like that. But most oral supplements are going to be in the 15 to 30 milligram range, depending on the salt or the delivery form of the supplement itself. But most of those are going to be taken daily, and depending on the form, they can have as low as only 10% bioavailability, some of them higher if they're chelated, such as an aspartate or picolinate, for example. And then with IV, the dosages are always going to be way lower than oral because, of course, you've got nearly 100% bioavailability, so you don't need nearly as high of doses. So you have to be more careful there in knowing what protocols you're doing and what salt form you're using and how fast you're giving it. But with IV, zinc does have to be diluted in at least 100 mLs of a suitable carrier fluid. The particular carrier fluid is going to depend on other additives and things in the bag and overall osmolarity and factors that go beyond this discussion. But just know that you should not push or fast push zinc via IV due to its typical acidic nature. So it really does have to be diluted in at least 100 mLs of a suitable carrier. And then on the IV side, typical dosing is in the 2.5 to 4 milligram per day or per treatment type of range, sometimes in the 5 to 10 milligram range, depending on more acute cases and monitoring. And there are cases where it goes significantly higher than that for shorter periods of time, but that's kind of the more normal range with, say, zinc sulfate or zinc chloride. But again, just keep in mind that you've got to account for the different salt forms and how much elemental zinc will be delivered there. So there are studies and uses for higher doses, but monitoring of blood levels and any side effects should be more so monitored when you get into that. And it could be given anywhere from daily in case of acute TPN need to even weekly or monthly on an outpatient maintenance type of supplementation. And then finally, intramuscular and subcutaneous are not recommended because, as I mentioned, zinc, just for stability, typically is very acidic, so it can actually cause local tissue damage. So that's why we really want to dilute it out well enough to give it via slow IV if we're not doing, of course, oral therapy. So testing and monitoring. So blood serum testing is the most common standard for monitoring zinc, especially in traditional acute care settings. It does give less overall information than intracellular micronutrient testing, but it is nonetheless useful in monitoring for normal levels and avoiding toxicity. Then on the other hand, intracellular micronutrient testing measures how zinc or other micronutrients affect cellular function in a person. So if someone is deficient in a particular nutrient, the intracellular micronutrient testing will uncover that deficiency so that it can be treated potentially more effectively, thus getting into deeper solutions. So not only correcting the intracellular deficiencies have potential for even things like slow aging and regenerative medicine and things like that, but it can really optimize zinc therapy potentially even deeper than just serum testing. Intracellular micronutrient testing, it really takes into account someone's more like biochemical individuality a bit more, and they can of course look at many other minerals and nutrients and that type of testing as well. But it might show a more full body status just to get a deeper assessment of what's going on. And then symptoms of zinc deficiency include everything from fatigue, dermatitis, acne, loss of taste, or poor wound healing, anorexia, decreased immunity, delayed growth, hypogonadism, delayed sexual maturation, diarrhea, skeletal abnormalities, alopecia, behavioral disturbances, white spots on fingernails, infertility, and night blindness. Those at more risk for zinc deficiency include alcoholics, malnourished people, those with malabsorption like Crohn's disease or celiac disease, people on long-term parenteral nutrition, those with chronic renal disease, anorexic dieters, pregnant women, the elderly, and those with sickle cell disease. So side effects and precautions. So zinc in very high doses for a long time could be impacted by poor renal function. So if the patient does have very poor renal function, that could warrant potentially lower doses, tighter monitoring, less frequent dosing. Just knowing you have to be more careful there that you couldn't go as much on the high side of dosing. And then in general, possible side effects, GI upset, nausea, vomiting, changes in taste, and headache. But the GI upset, nausea, vomiting, those are much, much more common with the oral therapies. But the other side effects, if dosing is not properly when given IV, again, since IV is 100% bioavailable, that could be at more risk of some of the other side effects. So IV, you do have to be more careful with the dosing. So here's some popular clinic protocols and ranges I typically see very often. So zinc sulfate's a very common one, for example, in 5 milligram per ml injectable. So anywhere from a half to 2 mLs in an IV slow drip, so in at least a 100 ml bag of a suitable carrier, whether it's normal saline or something of that nature. It depends on the combination of all the items. Then you've got various immune drips, combination drips of, say, zinc, vitamin C, and various B vitamins, and different combinations that can be done that way as long as osmolarity and everything in the bag is compatible and the osmolarity is okay. And then you've got just various vitamin mineral drips in combinations that can utilize zinc as well, but more often given in combination with something else, whether it's adding it to a Myers or an immune boosting drip or something like that is more often what I see. I don't see it as popular for, say, patients to come and get just zinc by itself, but it is a huge addition to something, especially like an immune boosting IV, for example. Then we've got drug and nutrient interactions. So some antibiotics, such as tetracyclines, penicillamine, and fluoroquinolones, can form complexes with zinc that reduces their absorption and effectiveness. So generally, it's recommended to separate the administration of zinc supplements orally from those, whereas probably not as big of a deal with a lot of these interactions. Actually, if given IV, a lot of these are when it's given orally and have to do with binding and things like that. But then with thiazide diuretics, such as hydrochlorothiazide, it can increase the urinary excretion of zinc, potentially leading to zinc depletion. So in cases like that, you could need higher supplementation of zinc. And then with iron supplements, zinc and iron compete for absorption in the GI tract. So once again, here we're just really talking about oral therapy. But high dose zinc supplementation orally could interfere with iron supplementation, just something to keep in mind. So generally recommended to separate the intake of those if given orally. And then with bisphosphonates, due to binding, again, you want to separate oral intake. But again, most of these are kind of countered by using zinc IV. They're more of a more notable when taken orally. So zinc in summary, we covered what is zinc, how does it work, various clinical support uses and benefits, from immune support, the typical area we think of, to all sorts of different areas, including hormonal support, administration options, such as oral versus IV, and that we shouldn't not do IM or sub-Q due to local tissue damage, testing and monitoring, and side effects and precautions, and popular clinic protocols. So that concludes my presentation on zinc. Here is our contact information if you want to connect with us, either sales@revcustomrx.com, or you can give us a call, 1-800-547-1399, or visit revcustomrx.com. And you can also connect with our different pharmacies in our network pictured here. Connect with us on social media and explore our other nutritional and different trainings available through Revelation to support providers. We have a huge array of topics, from overviews of IV and IM nutrition and all sorts of different trainings that you can access. So thank you for watching this presentation, and I hope you got a lot out of it.